Yes.
Okay, excellent. So my name is Staffan Darnolf. I'm IFES Senior Global Election Administration Operations Advisor. And thank you very much for having me. I will try to be as quick and swift as possible, because I know you know what. Yes. Someone want to say something, or should I just pursue?
No, proceed.
Okay, thank you very much. As I said, I will be quick and swift for a number of reasons. One is, of course, you all want to get into the discussions. Also, dear colleagues from A4 made a good presentation previously, but also we have just published a fairly extensive and detailed paper on this very topic. I believe it went live yesterday. So a lot of the information that I'm talking about right now, but also that I'm not addressing, you'll probably find in this paper. One thing to keep in mind when it comes to this paper compared to what other organizations have done is that we've actually been working with public health experts. So it hasn't just been election administration nerds like myself developing this. It has actually been developed in close collaboration with public health experts, and they've been sort of vetting the suggestions and recommendations that we include in this paper. Just a quick one before I jump into sort of the smorgasbord of things I will be touching upon. I think it's important to keep in mind the modes of transmission when it comes to COVID-19. We all know it's direct, so that's why we're trying to keep a social distance and wearing face masks. But we also, especially from an election administration perspective, face the risk of this indirect transmission risks as well. And as you see in the table on this slide, there's some fairly scary figures right there. If we're looking at the use of printed ballot papers and forms, that could have a transmission risk of 1 day. And when we're entering a polling stations, be that touching glass or metal doorknobs or something like that, it could be there for 5 days. And the same thing goes for in places where we're using various technologies that could also retain the coronavirus for up to 5 days. And this, of course, has fairly significant implications for the mitigation plans that we have taken in place. So let me talk a bit about sort of the fundamental things that an election authority probably should be focusing on from the outset. The first one is to actually conduct a joint public health risk assessment. Traditionally, EMB has been working a lot with various security entities in order to reduce the risk, so they have a rapport and a good understanding when it comes to that. But now when we're looking at the COVID-19, suddenly they need to engage often with the new partner, the public health department in a country. And it's important when you're doing this public health risk assessment, then you're not just focusing on the more obvious public-facing activities of the electoral cycle, such as voter registration, candidate nomination, and election day. It's equally important that you also include the ones behind the scenes, such as access to your offices, the work that's going on in your warehouses, and so on. You need to take a holistic view when you're doing this kind of risk assessments. And based on the risks that you've identified, it's important to develop this risk mitigation plan. And it will look very differently from country to country. In some places, it might be mostly an in-person paper-based solutions, while in other countries or states like having in the US, Oregon, they're doing 100% postal voting. So the implications of COVID-19 and how it transmits is drastically different, and therefore their risk mitigation plan will look very different as well. And then, of course, once you have this risk mitigation plan in place, you will need to go back and update your operational plan, revise your election calendar and budgets. Because if it is a decision taken to procure PPEs, for instance, and we know right now, at least if you're going to have the good, solid N95 mask, there is a global shortage. So you need to take into consideration if you can have them locally produced versus procure them international market. So that will impact your timeline. That's just one thing. But it could also be your training of your poll workers might take longer because you can no longer have 40, 50 people in each training session. So you need to have more training sessions with smaller groups. And this all have budget ramifications. I was in touch with our South Korean colleagues and learned that they spent just on PPEs on election day more than $20 million for the election. So that is a significant cost. So let me just touch upon a few things here when it comes to different facets of the electoral cycle. When it comes to electoral campaign, it very much differ from country to country. In some places, you have an EMB who has a very limited mandate, not much more than registering candidates, and then maybe dealing with complaints that are being filed. In other places, an EMB might be responsible for even the primaries of political parties, as well as allocating media access and issue code of conduct. So based on the legal mandate or responsibility that an EMB has, it needs to tailor its actions accordingly. And then also, our colleague at IFES mentioned some good solutions there. So I'll, in order to save us some time, I will go to the next one here. Voter education and strategic communications. As mentioned earlier, this is always a critical, important area for any EMB during regular or best of times, but even more so when we're facing a COVID-19. And yes, of course, they need to include information regarding COVID-19, but also since they're probably making a lot of changes to candidate nomination, voter registration, and election day procedures, that must also be communicated to the stakeholders. Another aspect here, though, that we shouldn't forget, it is that if you don't have a good voter education campaign out there, really transmitting what kind of improvements you have made in order to safeguard the elections, not just for the voters, but also for your own poll workers, that might have detrimental effect on your ability to secure poll workers. We've seen that in some of the primaries, excuse me, in the US, where they have really struggled to open up polling stations, not just because of voters not willing to show up, but they have not been able to secure sufficient enough of poll workers anymore because of the risk associated with that. A couple of good things, though, when we're looking at what health literacy says when it comes to their practices, is largely the same as any EMB would be facing. You know, you should a couple of things here. You should have a focus on the positive. Don't say that if you shouldn't be touching your face. You should communicate the positive ones of the steps then taken in order to make them as safe as possible. And in this instance, also make sure that you avoid using medical language that might not be familiar to a lot of your recipient of the information. As I mentioned before, when it comes to recruitment of staff, the EMB might be facing challenge. And this is something we've seen in a couple of places. Not only might you be forced to recruit more staff, but you also might find it difficult to recruit from your normal standard pool of poll workers. You might have to have more staff because you're not as sure if people will actually show up on election day to do the work because they might be nervous. But it could also be because you're changing the procedures. Maybe you decide to introduce a thermometer before people entering the polling station. So you need to hire an additional person for that. You might decide that social distancing is so essential that we want to have a queue controller that's reinforcing this. So suddenly, if you have, say, 10,000 polling stations in the country and you're adding 2 staff to each polling station, you need to recruit and train 20,000 additional staff. And coming to existing pool, in quite a number of places, we see that poll workers is predominantly coming from the educational sector, but also a lot of them from the health sector. And of course, for obvious reasons, during a pandemic like this, we don't want to reduce the number of health workers that are performing their primary duty of keeping the nation's population safe, so they can no longer be recruited from. But also what we see in a lot of the European countries is that the poll workers are primarily people that are elderly in the 60s and the 70s, but those are at the high risk group. So maybe it might not be the wisest to bring them out and being potentially exposed to people with COVID-19 for a full 12, 14-hour workday. So that requires you to recruit from another pool of personnel. When it comes to the training, what we've seen so far is that generally the EMBs is pretty good in making adjustments to the manuals and to the trainings when it comes to the changes of forms or the steps that's being introduced to keep people safe. What we've seen, they focusing less or sometimes not at all. It is actual proper use of the PPEs, the personal protection equipment, be that face masks or gloves and these kind of things. It might sound very, very trivial, but there's a reason why if you go to med school, you're going to be a nurse or a doctor. They actually spend a lot of time teaching you how to properly put on a mask, how to retain it effectively and take it off effectively. And the same way goes for gloves. So this is an important component that needs to be included in the poll worker training. And not only is it for the poll workers, in some places you might decide to procure gloves and or masks for the voters. And then it's essential that the poll workers give proper instructions to the voters when he or she comes forward in order to receive the PPE in question. When it comes to opening up your location for the public, be that for voter registration, candidate nomination, or on election day, it's already a number of good points been mentioned here about location, layout, consider the number of the voters per day, be that doing it over a longer period of times, or is it assigned groups to certain time slots of the day? I will focus on one topic again where we've seen some deficiency when it comes to the EMBs that are moving forward with elections or electoral processes during the pandemic. And that's actually the exit and entry, the access protocol to the facility. Often we see that they're using one door both for entry and exit. And there at these doors, it's difficult for them to keep a social distance. So a couple of things that could be done. Often we use schools for polling station. You just have dedicated doors for entry and a different one for exit. If that's not possible, you can put an election official who will help with that. But irrespective of that, we will have thousands of people using this door in a very short period of time. So it's important to have a rigid cleaning protocol in place of public areas like this in order to reduce the risk of transmission during exit and entry of polling stations. Another common interaction that we see on election day is, of course, when you're checking in the voter. Often it is a voter comes forward, hands the ID card to the poll worker who looked the person up in the voter register, and then the registrant will sign the register. This is obviously problematic if you want to keep social distancing. We've seen in some places where they have the time and the money, they're procuring plexiglass that are being put in between the poll worker and the the voter. But this is difficult if the voter needs to sign the voter register, because how do you exchange this voter register if there's a plexiglass between you? Sometimes it's just a matter of what I have called an exchange table. They're being set up at a distance between the voter and the poll worker, where the voter goes up by herself to the exchange table, put down the ID card, steps back, and then the polling official steps forward, looks at the ID card, finds the person in the register, steps back, and then the voter steps forward and signs the register. This is one easy way of doing it, but as you can see, it includes a number of steps which will reduce the pass-through pace for a voter in a polling station. It might have ramifications for your opening hours, but it's one practical way of overcoming if there's not enough time to procure certain mitigation instruments to reduce the risk of transmissions. A bit about doing a remote options as voting. I mean, IFES recently released a paper, and Meredith is one of the authors of this good paper when it comes to internet voting, about the pros and the cons about that. I will just mention something when it comes to the postal options. We need to keep in mind that also the postal servers will suffer from this COVID-19 pandemic. So if they might normally been able to produce a reasonable job, but if you're now asking them to do this when they're already under strain, maybe a postal service that used to be proficient might no longer be proficient. And also looking at the EMB itself, the EMB will be under a lot of strain in order to change and adjust the procedures, doing procurement, different trainings, just to accommodate the normal, regular polling stations. And if we're now asking them to add a new or potentially significantly enlarged postal component, that might come at the detriment of the in-person voting on election day, which is supposed to be catering for a vast majority of the voters. So just like my colleague mentioned earlier, I think if you're looking at the postal ballot solution, it's more for select discrete groups of voters that you might want to introduce this to. Just a quick word on when it comes to the vote count and results management. What we've seen to date is that EMBs tend to be fairly good in keeping a distance when it comes to the poll workers doing the counting. They've been less successful in making sure that party agents and observers can actually do their job, do their function by having access and seeing the ballots, so they cannot fulfill their duty properly on that. What we also see they don't pay enough attention to is actually what happens once you're done with the counting and start sending the material back for tabulation at the next administrative levels. It tends to be presiding officer, maybe a security guy, and observers piling into a vehicle with no guidance, no PPEs or anything like that, completely compromising the integrity of this from a public health perspective. It's important, again, not just to focusing on the main events, the public events, but also these behind the scenes parts of the process. So just in closing, sorry for taking so, before you decide a country whether you're going to go ahead with elections or not during the COVID-19, it's the status of the disease transmission in the country. You know, where are you? Is this the beginning? Is this the end of it? What's the rate of transmissions and mortality rates are you facing? How much has the EMB been able to coordinate and put in place mitigation strategies with help of the health authority? How much have you been able to communicate these kind of changes and improvements you've done to your stakeholders, including the owners? Also, are you really able to procure all the necessary PPEs in a timely manner so you can honor all the changes that you envisage you're going to be doing on election day. We've seen that in some elections on the African continent where the EMB has had the intention of doing a lot of these improvements, that then on election day, the PPE materials arrive so late that largely they will only be available in the urban areas and not the rural areas. So I think I stopped there. So thank you very much.